Are you going to call the meeting to order?
Yes, Marcin, thank you very much. I will call to order this September 28th meeting of the Health Equity Outreach and Consumer Experience Advisory Committee. Marcin, if you would like to start us off with, I think you have an introductory statement, and to call the roll, please.
Yes, Mr. Chair. It is requested that participants introduce themselves every time they speak. Roll call votes will be taken for every action item. This meeting is being recorded for minute-taking purposes, as well as posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website, following a recommendation of an Access Health CT board member. And I will call for the roll call for attendance. Sean King, Chair.
I'm here.
Thank you. Deb Pollen. Sheldon Taubman. Giselle Carota McDonald. Leslie Greer.
Present.
Thank you. Holly Hackett.
Here.
Thank you. And Gerald O'Sullivan, subject matter expert from SID. I believe he will not be able to join us today. Thank you, Mr. Chair.
Thank you, Marcin, and excuse me, welcome everybody once again. And maybe should have led with this, but for those of you who may not know me, my name is Sean King. I am currently the acting healthcare advocate for the state of Connecticut. By virtue of that post, I am also currently a new board member for the Access Health Board of Directors. And at our last meeting, the Board of Directors, I was also designated as a member and chair of this particular committee. So this is my first time meeting many of you, your first time meeting me, but welcome. And with that, I will go ahead and get into introductions of the Access Health Senior Leadership Team who have joined us today.
Good afternoon, all. This is James Michel. I'm the CEO of Access Health Connecticut. Thank you. And Sean, welcome to the team.
Thank you, James.
Thank you.
Good afternoon, Tammy Hendricks, Director of Health Equity and Outreach, Access Health Connecticut. Welcome, Sean.
Thank you, Tammy.
Good afternoon, this is Glenn Jurgen, Director of Human Resources with Access Health Connecticut, and welcome aboard, Sean.
Thank you, Glenn.
Good afternoon, Susan Richby, Director of Legal and Governmental Affairs, Access Health Connecticut. And I chime in and say, welcome, Sean.
Thank you, Susan. Nice to see you.
Janelle Maloney, Information Technology Director, and I echo that, Sean. Welcome aboard.
Thank you, Janelle. Good to see you.
You're welcome.
Is that everybody?
It is my understanding that that concludes.
All right.
Go ahead,
Thank
Mr.
you,
Chair.
and welcome again, everybody. Moving to the next item of on our agenda, public comment. I'm told that we have not had any members of the public submit comment for this meeting. If you would confirm that, Marcin?
Yes, Mr. Chair.
Okay, so then we'll move on to review and approval of the minutes of the May 2nd meeting of this committee. I will entertain a motion to approve those minutes. Is there a motion to approve the minutes of the May 2nd meeting of this group?
If anyone is talking, you might be on mute.
I think there are only 3 of us as voting members who can make a motion. I'll call one more time for said motion.
Motion to approve.
I think that was Leslie. Thank you, Leslie. I'll go ahead and second that motion. Is there any discussion on the motion? Hearing none, I'll ask for a roll call vote.
Sean King?
Yes.
Deb Pollen? Sheldon Taubman? Giselle Carlotta McDonald.
Yes.
Thank you. Leslie Greer
Yes.
and Holly Hackett.
Yes.
Thank you.
Okay, 4 yeses, so the motion carries. Moving on to our substantive agenda today, we're beginning with a Medicaid Unwind update, and I will turn the floor over to Tammy. Thank you, Tammy.
Hey, good afternoon, everyone. Happy to have everyone back together. Once again, welcome, Sean. Thank you for your willingness and your enthusiasm to lead this committee. Big shoes to fill, but I have no doubt that you will continue to help us do great work. Wanted to give some updates today for the Medicaid Unwind, and this is going to be on behalf of a few departments. So I'll try my best to answer questions, but if you have specific questions, happy to take it back to the department that you're asking and get an answer for you. Starting with a short policy update, CMS, Centers for Medicare and Medicaid Services, is asking that all states use all of the tools available for the unwind to ensure that eligible consumers are not terminated. And states are also required to evaluate their systems to ensure that the automated renewal process is compliant. So that's been a focus of ours. From the technical operations and analytics side, we have some data for the unwind. This data is accurate as of August 31st. Currently, we have around over 2,300 individuals enrolled in Covered Connecticut program, over 5,600 individuals enrolled in a qualified health plan, and this is excluding the Covered Connecticut benefits. We have 134,000 individuals re-enrolled in Medicaid, in CHIP. Over 9,700 individuals have indicated that they are not requesting or are receiving health insurance elsewhere, and that could be through Medicare or employer, et cetera. We've also included a link here to the DSS dashboard, and that contains all of the Medicaid data that they share with CMS on a monthly basis. So that could be a helpful tool for you all to see as well. More data from our operations side. The call center is ramping up staffing for open enrollment. I believe we just added 2 new classes, and of course, to manage the increased calls due to the Medicaid unwind. So some stats for the call center: they handled over 405,000 calls from April 1st to August 31st. This is a 36% increase over last year. And the average wait time for the Medicaid unwind period has been a little under 2 minutes, so 1 minute 59 seconds per call. I'll pause here for any questions. Okay, we've moved on. Okay, we can move on, Martin. Thank you. From the health equity and outreach side, monthly meetings continue. We are meeting with consumers on a monthly basis for our Healthy Chat series, really just teaching consumers how to enroll, what's new at Access Health in terms of plans and options and financial help. So really getting them comfortable with the information so that they can enroll, whether that be on their own or find us at an in-person fair. We're also meeting with community partners and CACs on a monthly basis, getting feedback from them, also giving them updates, and really just trying to find better ways to work together with them to help them serve the clients that they see as well. We have enrollment staff that are rotating to our different navigator locations and also a few community organizations. They're helping on site with in-person enrollment. And we're rounding out the month of October with 2 more fairs that will wrap up right before open enrollment begins. And so October 2nd will be at Litchfield Community Center. And then October 21st will be in New Britain. the public library. So efforts continue for the Unwind right up until open enrollment, which of course opens it up for our usual crowd and helping consumers that are eligible during that time. Quick marketing update. The marketing team continues to support all of our outreach efforts, geo-targeted emails, meaning that they're promoting to people who are specifically in those areas that we're having events. They're doing a lot on social media, both organic and paid. And they're supporting us with press releases, making sure that everyone knows where we will be, as well as getting us added to community calendars. So right now, the marketing campaign is in market. For the Medicaid Unwind, these ads will pause as of October 30th to January 8th, which is when open enrollment campaign will be in place. And so we don't want competing messages. So during that time, the Medicaid Unwind campaign will be put on pause to accommodate for open enrollment. And of course, they will continue with direct-to-consumer mail, email, text messages on a monthly basis throughout an open enrollment period. So hopefully these updates were helpful. I'm happy to answer any questions. And again, if you have any specific questions, I can bring it back to the specific department and get back to you on that.
Any questions or comments for Tammy? I do have one, Tammy, that I'll just throw out there, and I don't. This may be just me demonstrating my naivety of some of the prior work of this committee. Is there ever been anybody ever explored potential partnerships with the State Department of Education and school districts, just in terms of getting messages out to families who may be faced with losing their Husky benefits or their CHIP benefits, especially?
Yeah, sure. So my team, we connect with over 2,200 community partners throughout the state, and that does include a lot of the school districts. So we can get specific with which ones we've connected with, but we've connected with a lot of them, including a lot of state colleges, community colleges as well. So we expand our outreach services to a lot of organizations throughout the state.
Very good.
And
just was something I was curious about.
Yeah.
sorry, this is Susan. And Sean, just to add, in addition to Tammy's team's work, the marketing team also works with DSS and with the school districts every year, and they have pieces that they put together for backpack, fillers to go home with the kids. And so they worked on a really good one this year, especially with the Unwind, to get that messaging, and covered Connecticut to really make it easy for people to understand. So those went out. I don't know exactly when they go out, but those were all done over the summer as well.
That's great. Okay. Any further questions or comments before we move on to open enrollment 11? And now I'll turn the floor over to Catherine.
Thank you, Chair. Thank you, Tammy. I have some high-level updates my name is Katie Hearn. I'm the Associate Director of the Enterprise Project Management Office, or the EPMO, at Access Health CT. I have some high-level updates for you today in terms of technology efforts, marketing efforts, and an overview of health equity and outreach for open enrollment. Currently, my department, the EPMO, is tracking more than 20 projects. We've been focusing our attention of late on preparing for open enrollment 11. We are on track to open up November 1st, as we do every year, for open enrollment, and OE 11 is expected to run through January 15th. This year, because we do have some major changes in terms of our technology vendors, We're actually using 2 project managers to manage the open enrollment effort. One is focused on operations activities, and the other is really working closely with our IT department, our TOA, or Technical Operations and Analytics department, and our IT vendors. This year, we have Infosys taking over the maintenance and operations of our HICS system, running our batch jobs, our projections, our auto renewals, these kinds of activities, while we have Deloitte continuing to make changes and enhancements to our system for system releases. So it's a major change, that we're monitoring very closely. But so far so good. We're working with both Infosys and Deloitte very closely, just about every day. And also this year for open enrollment, we will have dental plan auto renewals in the individual market. So standalone dental plans will be auto renewed through the HICS system for the first time. When we moved our standalone dental plans to HICS last OE, we saw an increase in enrollment, and we think that this will help with enrollee retention. And then another change for this enrollment is that we will be utilizing the national change of address service through the U.S. Postal Service. That will be connected with HICS, so we will be able to determine many individuals who have recently moved, and this in turn should help to cut down on our volume of return mail, which can be a challenge. Next slide, please. I have a high-level view of marketing in terms of OE activities here. If you do have any more questions about marketing activities for open enrollment, we can connect you with Caroline Ruette, the Director of Marketing. We can take back any questions you have. So the marketing department is analyzing and incorporating the feedback from 6 focus groups. They did a lot of market research with our customers, subsidized customers, unsubsidized customers, Spanish language speakers, the uninsured, the underinsured, and they're using that not only to figure out how to target their marketing efforts, but also how we can improve the customer experience. And marketing is also developing its collateral to share with the Health Equity and Outreach team this year for distribution to our community partners and to our Connecticut residents. There are always some updates every OE, so there are always opportunities to update our materials and our website. There is new blog content on our website and new toolkits available for this open enrollment as well. The advertising campaign and the media plan for open enrollment is underway. Our ads will be on television, on the radio, in print. We'll have digital ads, including social media ads and out-of-home ad placement, which would include like billboards and ads in other public spaces. And we do have ad footage this year shot on location right in Connecticut, in Hartford and New Haven. And the next slide, I'll give you an overview of OE Health Equity and Outreach activities. We do have virtual healthy chats, one last week, and we have one coming up on October 18th. These are open to the public. These are a great overview for anyone new to Access Health, or for anyone who's not new to Access Health but has questions about pretty much anything, I think. We also have community partner Zoom meetings scheduled the first Thursday of every month. And those are good for our CACs, who are our enrollment specialists in the field in places like community health centers and hospitals and so forth. That gives them an opportunity to learn more and learn what's changed or what's new. And finally, we have a lot of in-person help this year, as we always do for open enrollment. We have about 20 enrollment fairs planned between November and January. The community conference, which is in person this year, is planned for October 11th. Tammy, the Director of Health Equity and Outreach, whom you just heard from, can give you more information about that or anything else here. And we have our 4 navigator organizations, the same organizations that we worked with last year, I believe, are on board for this OE. And we have our standing enrollment locations where customers can go for in-person help during open enrollment at the East Hartford and Stamford Public Libraries. And I can take any questions you have. Thank you.
Any questions for Katie or comments? Okay, hearing none, we can move to the next item on our agenda, an update on a Broker Academy, and this brings us back to Tammy again. Take it away, Tammy.
Brings it back to me. Thanks, Sean. So, things are continuing to move along for the Broker Academy. We're nearing the end of the year 2 program. 21 students passed the state exam and have been matched with experienced brokers, certified Access Health brokers. We do have a few students who are in the process of retaking the exam. Hopefully that goes well for them, but we'll continue to work with any student who's committed to completing the program. Although we had a few less students this year, the retention increased from 41% last year to now 52%. So we're retaining more students as we go along. We're constantly making adjustments to the program, how to make it better. So I think that retention rate going up is showing it's the result of that effort. There are 7 mentor agencies for the program this year. Most of them were a part of the program last year. So we're happy to have them back and some new ones. And so now at this point in the program, the students have transitioned to our broker support team, our internal broker support team that's led by John Carbone. And they've been doing a great job continuing to keep connected with the students and keeping up with the mentors as well as they work with all of our certified brokers throughout the state. So right now we are in the midst of planning a graduation ceremony for the students, which will be at the end of the month in Middletown. This location happened to work really well for us last year, so we're returning this year. And it's just a really great opportunity to get all the students in one room. As you all know, that there was 2 separate classes, although they might have gotten together virtually. This is really the first opportunity they can get together, both classes from Hartford and New Haven, get together and also meet some of the Access Health staff in person as well, if they didn't do that before. So moving on, open enrollment is fast approaching. We have a lot of fairs coming up, as Katie mentioned in her slide, and the graduates all participate in these fairs with us. So the Broker Academy students play a really important role in our enrollment fairs because many of the areas that we hold these fairs are underserved, hard to reach, higher uninsured rates, and we have data saying that most of those areas have a high population of folks that are impacted by the Medicaid unwind. So Broker Academy graduates play a major role in helping us connect even more with folks at our in-person events in these specific areas. And finally, I just wanted to mention we've had a few changes to the Broker Academy website. We added a contact form. I've gotten some feedback from my team that we've gotten folks who are interested in learning more. So we'll collect this information in between the class dates. So now that the second year has wrapped up, we'll continue to contact folks and keep in touch with folks that are interested in the program. So when the new year launches, we can gather them up and give them all the information. So previously we were marketing the program as the new year begun, but now we'll try to do it continuously throughout the year, if that makes any sense. So we're excited to add that contact form so we can continue to get folks that are interested in the program, get their information so we can keep in contact with them throughout the year. And I'll pause there for any questions, comments, concerns.
Any questions for Tammy? Seeing none, we can continue to move rather quickly through today's agenda. Tammy, the floor is still yours for our community outreach update.
Yep. So I covered a lot of the efforts earlier in terms of the unwind. Katie went through a lot of our plans that we have for open enrollment. There's really a lot going on, but I just wanted to highlight a few more things. First, you know, the outreach team have attended 216 in-person events so far this year, and that's almost 122% increase since last year in terms of number of events. And this is huge for us because we decided to grow the outreach team internally, and we're seeing the great results from that. Building stronger connections with our community partners, connecting more with consumers through consistent events. It really is showing the benefits of building and creating an internal outreach team and growing that team. And of course, as we mentioned before, as Katie mentioned earlier, we have our community conference that's coming up, and that's a great way for us to connect with community organizations, CACs, brokers are invited to that as well. We give a lot of updates on open enrollment, and it's a great time for us to get any feedback to see if we can help them, help our partners throughout the open enrollment period. So if you don't remember, last year we did a few regional meetings, smaller meetings to be mindful of COVID. So this year we're going back to one big event. We are expecting about 150 people. Well, that's our max. So we're certainly looking forward to it. And I'll pause here for any questions or feedback.
Okay.
Easy crowd
Hands
today.
raised. It's a quiet group today.
Quiet group.
Well, Tammy, thank you for those updates. Very informative. I will go ahead and move to the next item on the agenda, which is a call for any future agenda items. From those present, if there are any ideas, anything you want to add to the next meeting agenda, now's the time to speak up. Of course, we can add things later on as well. Membership is still quiet, so we have no future agenda items at this time, but I'm sure we'll find plenty of things to build an agenda with for our next meeting.
Mr. Chairman, very quickly, a couple of future agenda items that I would like to bring to the committee's attention. Number one is, as we enroll, when open enrollment starts, and we could give updates on our enrollment numbers for 2024, and also sometime in the near future, we would be nice to give we are doing a leaver survey. A number of folks who lost coverage doing unwind and have not come back to re-enroll either in Medicaid or to purchase insurance through Access Health. We're going to do a survey. We're going to start the survey rather sooner than later to try to ascertain as to why they're not coming back to re-enroll. Now, we suspect, we've done these surveys before, about 80% of the times because they now have the health insurance through their employer. As to why people are not coming back to re-enroll. Some have moved on to Medicare. Some have moved out of state. Unfortunately, some may have died. largest majority of them is because they have jobs now that provide health insurance for them and their families. So again, once we have the survey results, we will come back to this committee and present it to this committee after we present it to the board. So that's one big one to come down the pike. We're looking sometime early next, late this year, or early next year. We'll have those results, as well as enrollment numbers as we move forward, and also as we develop our outreach efforts for open enrollment. If we could get some guidance from this committee, we will come to you as well. Thank you.
Thank you. Thank you, James. All good topics to cover at the next meeting. We'll make sure that those are included in our next agenda. I see that Sheldon's hand is raised. I'll let Sheldon go ahead.
Hi, thank you very much. And first of all, I'm very sorry I was about 13 minutes late for the meeting, so I missed the introduction, and I also missed, I guess, Sean being introduced as the acting director of the office. Is that accurate?
That is accurate. I'm the acting healthcare advocate at the moment, and just to recap, at the last board of directors meeting, I was also assigned to this particular committee, taking over as chair for Ted Doolittle, who has moved on from our office, as well as and I might just take this moment real quick, if you don't mind, Sheldon. I was remiss at the beginning to acknowledge Ted's service to this committee, as well as a few other members who were recently removed from the committee after some prior service. CC Woods, Kevin Galvin, and Karen Siegel. Just wanted to acknowledge their past service to this committee and thank them for the time they spent with us. But with that, Sheldon, go ahead. You had some other comments.
Thank you, and thanks for the recap, which I'm sorry, you had to do that for me. So I had two suggestions for, since you're inviting future agenda items. One is a report maybe on covered Connecticut, and that, if that's properly in the province here, and that's both in terms of like enrollment, like what's happening there. But the other thing that I'm very interested in is, if you have data on it, if somebody has data on it, is the how covered Connecticut is not Medicaid, but one of the things that was attempted to do was to fill in the blanks of what you get in Medicaid versus what you get in the exchange, specifically dental and non-emergency medical transportation. A report on how much people are accessing it and how they access it, those other benefits. Is that, I mean, that's just a suggestion of an agenda item. And then the other. Go ahead.
Sheldon, we could definitely give you the enrollment information by carrier, by plans, but the other data, those are claims information, which we don't have access to. Right? So, we may try to, we'll reach out to the carriers, see if they share that information with us. But historically, they have not shared that with us. But we'll reach out to them, get that information. Okay. I think the state has that. Because they're submitting information to the state to get reimbursed by the state. But we don't have access to that information. But the enrollment numbers we definitely have access to because they're our information. So we'll get that to you at the next meeting.
And this is Susan. Sheldon, the dental information would come from two sources. As James mentioned, the plans have pediatric dental benefits that now go up to age 26. So anyone in covered Connecticut in the silver plan would be getting those dental benefits. And then covered Connecticut also includes a separate adult dental benefit that's being administered by the Department of Social Services. So they would have that information.
Would DSS also have the NEMT information?
Yes, that's correct. They're administering that as well.
So maybe that's the way it has to be asked from both the plans and DSS in order to get at it.
So Sheldon, again, we'll reach out to DSS and we'll invite them to be at the next meeting to present those information to you.
Okay, thanks. And then my other thing is I'm sorry to interrupt. Did you have something else to say?
No, I'm good.
My other thing is very, very parochial, very narrow. It relates to one of the issues I've been working on because I'm working at Disability Rights Connecticut, and our folks are all disabled. They're disabled in a variety of different ways. One of them is that a lot of them have mobility impairments and use wheelchairs. And an issue has come up. I'm on something, I forget what the title is, but it's the Wheelchair Repair Task Force. Basically, there's a real problem of delays in people getting their wheelchairs fixed. Maybe a few other people on this know something about that, but maybe Sean, you've got complaints about it. It's a really huge problem. I'm not here to complain about that. I'm here to just ask related to that. In the context of that committee, a question came up about coverage of wheelchairs, and it was suggested by somebody that the plans don't have to cover wheelchairs. And when I say wheelchairs, I mean CRT or complex rehabilitative technology, or the more common term is custom wheelchairs. So they're not necessarily electric, but they're customized, and they're not like a off the shelf, $300 something. Anyway, that wasn't actually required to be covered. And does anybody know the answer to that, or how we can quickly find it? Or
Susan, can you talk about that?
I don't know the answer, Sheldon, but we can certainly look up. You'd have to look up plan by plan in the schedule of benefits, and I don't know if there's any state mandate, on coverage of that nature.
There isn't. There's not a state. The reason I say that, I know one legislator has talked about passing such. So I'm guessing that we don't have it now. But that doesn't mean it's not provided, right? So that was my question.
It could be provided. Then you'd have to look, if it's not a mandate, you'd actually have to look at the schedule of benefits plan by plan to see what's, covered and what's not.
Thank you.
Okay, thank you.
Thanks, Sheldon. Anybody else have any comments or thoughts on future agenda items? All right, hearing nothing else, I will call for a motion to adjourn. Nobody's in a hurry to leave.
I move to adjourn.
All right, moved by Sheldon. I'll go ahead and second. Marcin, if you would take the roll call vote.
Yes, Mr. Chair. Sean King,
Yes.
Deb Pollen, Sheldon Taubman,
Yes.
Giselle Carlotta McDonald,
Yes.
Leslie Greer,
Yes.
and Holly Hackett.
Yes.
Thank you.
Thank you, Marcin. Thank you, everybody, for your participation today. Thank you to Access Health, Tammy in particular, and Katie and James for your presentation today. Everybody enjoy your evening. Good to see you all.
Thank you.
Thank you all very much.
Thank you very much.
Bye-bye.
Thank you, everyone.
Thank you.
Thank you.